Jacob Zuma, when he became president of South Africa, saw HIV as a low-hanging fruit to distinguish himself from Thabo Mbeki. I had known Jacob Zuma when I was the deputy chairperson of the South African National AIDS Council, and he never showed any passion or commitment or drive when it came to HIV. The real will came not from the president, it came from the Minister of Health when Minister Motsoaledi was made the Minister of Health. He almost out-activists the activists at times, but he allowed activists to rally behind him. He allowed healthcare workers to rally behind him, and it was that momentum that carried us forward. So I would give very little credit to Jacob Zuma other than to say that he didn't oppose it.
Even our health minister, who was appointed by President Zuma, now turned against him by publicly supporting a vote of no confidence twice.
This is where I've always felt some pity for Minister Motsoaledi, is that he is probably one of the best health ministers in the world, on the planet. But his near 10 years as health minister have mostly not yielded good results. The reason why it has not yielded good results is because health is so interconnected with other spheres of governance, whether it's the quality of basic education and keeping girls in school, whether it's public services and ensuring that your infrastructure is maintained, whether it's ensuring that there's a good treasury that understands the need to finance health. In that kind of ecosystem of government, he finds himself relatively powerless because all of those other government departments have become very, very badly corrupted, and his own health department has become very badly corrupted. You know, you look at his dependence upon the provinces and upon MECs to implement all of his programs. Well, when you have a Free State that is captured by the Guptas, you know, when you've got a Northwest that is captured by the Guptas, your ability to see a program through from conception at a national level to the district and to the clinic becomes very, very limited. And I think that that is what has made him take a stand. And certainly Motsoaledi is going to pay a price for this.
So the government which appointed him crippled him?
Yes, exactly. He was able to succeed with antiretroviral treatment rollout because of the energy of activists and people within the healthcare system. But in areas where he had no control, he was crippled.
You said Motsoaledi will pay a bad price. What do you think the price would be?
I wonder how long he will remain as Minister of Health, at least if Jacob Zuma remains the President of South Africa, and also if the results of the conference, ANC conference in December, see the Zuma faction consolidate or hold on to power. I don't think that this minister will survive, which will be a great pity.